All right, so we're diving into these materials about peptic ulcers and GERD.
Oh, yeah.
It seems like we're really getting into
The nitty-gritty.
yeah, the nitty-gritty of what happens when things go wrong in our stomachs.
Absolutely.
So we've got these excerpts from a medical lecture by Dr. Khaled Hasan,
Right.
and we're going to break down all the complexities of these conditions,
Yeah.
how they're diagnosed, and what treatments are out there.
And we'll make sure to highlight the most, surprising and interesting bits along the way.
For sure, for sure. Now, I have to admit, when I think of ulcers, I immediately think of pain.
Yeah.
But Dr. Hassan's lecture points out that the symptoms can be a lot more diverse than just a stomachache.
That's right. You mentioned in your notes that you were particularly interested in the role of stress in ulcer development.
Yeah.
We'll definitely get to that. But first, it's important to understand that peptic ulcers aren't just an annoyance.
Yeah.
They can have some pretty serious consequences.
Okay, so let's start with the basics.
Mm.
What exactly IRT is a peptic ulcer?
It's a disruption of the stomach lining.
Okay.
A literal sore that forms in the stomach, or duodenum.
Oh, wow.
The lecture uses this very technical term, disruption of the mucosal integrity.
Right.
But basically, picture a break in the protective layer that keeps your stomach safe from its own acid.
Ouch, that sounds unpleasant.
Yeah.
And you mentioned serious consequences.
Yeah, if left untreated, ulcers can lead to bleeding obstruction and even cancer.
Oh, wow.
So definitely not something to ignore.
Right.
And speaking of things you might not expect, did you know that weight loss can be a symptom?
Really?
Yeah, it's because ulcers can make eating painful and even interfere with how your body absorbs nutrients.
Wow. I had no idea about the weight loss connection.
Yeah.
So it's more than just discomfort, it's affecting your whole system.
Exactly.
Now, what causes these sores to develop in the first place?
Well, the usual suspect is a bacteria called Helicobacter pylori.
Right.
Many people have heard of it.
Sure.
But what's fascinating is how it actually causes damage. It weakens the stomach lining, making it vulnerable to attack from the acid that's naturally present in your stomach.
So it's like setting the stage for an acid attack.
Exactly. And then there's the issue of NSAID overuse.
Uh-huh.
Those are your everyday pain relievers like ibuprofen and aspirin.
Right.
They disrupt the production of prostaglandins, which are like your stomach's natural defense system against acid.
Prostaglandins. Those sound important.
They are.
So popping too many painkillers can actually make your stomach more susceptible to ulcers.
That's right. And then, of course, there's the stress factor you mentioned earlier.
Yeah, I've always wondered how stress actually leads to ulcers. Is it purely psychological, or is there some kind of biological mechanism at play?
It's not just a saying.
Okay.
Emotional stress really can increase your risk.
Wow.
And there is a biological connection.
Okay.
When we're stressed, our bodies release hormones like cortisol,
Right.
which can alter blood flow to the stomach and even affect the production of those protective prostaglandins we talked about.
So it's a combination of weakening the defenses and ramping up the attack.
Precisely. Now, shifting gears a bit, how do you know if you actually have an ulcer?
Right. Diagnosis. I imagine a simple blood test wouldn't cut it.
You're absolutely right. A blood test can detect H. pylori antibodies,
Okay.
but it doesn't show the actual ulcer. You need to actually see what's happening in the stomach.
Yeah.
That's where procedures like endoscopy come in.
Endoscopy. That's
Yeah.
where they send a tiny camera down your throat,
Yeah,
right?
Exactly. It's a little bit squeamish, but it gives doctors a direct look at your stomach lining. We've even included a link to an endoscopy video for you,
Oh, cool.
so you can see what it's all about.
Awesome.
There's also another technique called a barium swallow, which uses a special contrast dye to highlight the stomach and esophagus on X-ray images.
Okay.
We've included a video of that procedure for you as well.
So it's a combination of visuals and lab tests
Right.
to get the full picture.
Exactly.
Okay, cool. So once the diagnosis is confirmed, it's time to talk about treatment.
Yes.
Yeah.
Let's move on to treatment options.
Well-
So when it comes to treatment, it's not just about, popping pills.
Right.
In fact, one of the most effective strategies for both ulcers and GERD is
Yeah.
making lifestyle changes.
Okay, so before we even get into medications,
Yeah.
let's talk about what we can do on our own
Right.
to help our stomachs heal.
Absolutely. Stress reduction is huge.
Okay.
Remember how we talked about stress hormones like wreaking havoc on your stomach?
Uh-huh.
Finding healthy ways to manage stress like exercise or meditation
Yeah.
can make a big difference.
For sure.
And then there's smoking.
Right.
It's bad news for your entire body,
Yeah.
but it also impairs healing and increases acid production in the stomach.
Oh, wow.
So quitting smoking is a must for anyone dealing with ulcers or GERD.
So taking care of your overall well-being is essential.
Yes.
What about diet? Are there specific foods that can help or hurt?
There's no one-size-fits-all diet for ulcers or GERD,
Right.
but some common culprits can trigger symptoms like spicy foods, citrus fruits, caffeine, and alcohol. It's about paying attention to your body
Okay.
and identifying your personal trigger foods.
So it's a bit of detective work
Yeah.
to figure out what your stomach can handle.
Right.
But even with lifestyle changes, sometimes you need a little extra help.
Of course.
Let's get into the medications.
All right, let's talk meds. The first line of defense for neutralizing acid are antacids.
Okay.
They're easy to get over the counter
Yeah.
and provide quick relief by neutralizing the acid that's already in your stomach. Think of it like throwing baking soda on a spilled acid.
Okay.
It neutralizes the immediate threat.
So it's like a quick fix for when those heartburn symptoms hit.
Yeah,
But I imagine it doesn't address the root cause of the problem.
exactly. Antacids are great for symptom relief, but they don't stop your stomach from producing acid in the first place.
That's where those other medications come in, right?
Yes.
The ones that actually target acid production.
You got it. One category is H2 blockers.
Okay.
They work by blocking a specific pathway that triggers acid production in the stomach. Think of it like intercepting a messenger before it can deliver its message to start making acid.
So it's like cutting off communication at the source.
Exactly.
Are there different types of H2 blockers?
There are a few different ones available,
Okay.
and they all work similarly,
Yeah.
but have varying strengths and potential side effects. Some common ones are cimetidine, Tegamet, ranitidine, Zantac, and famotidine Pepsid.
And then there are the PPIs, proton pump inhibitors.
Yes,
They seem to be the heavy hitters in the world of acid blockers.
they are.
How do those work?
PPIs are like the superheroes of acid suppression. They directly target the proton pump, which is the final step in acid production.
Right.
It's like shutting down the factory that makes it the acid, regardless of who's giving the orders.
Wow, that sounds incredibly effective.
It is.
So they're stopping acid production at the source.
Exactly.
Yeah.
And one interesting thing about PPIs is that they're pro-drugs.
Pro-drugs?
That means they're inactive until they reach a specific environment in your body. Interesting.
It's like they have a secret mission and need to be activated at the right time and place.
Okay, that's fascinating. So how do they get activated?
They need the acidic environment of the parietal cell's secretory canaliculi.
Okay.
That's where acid production happens.
Gotcha.
Once they're in that acidic environment, they transform into their active form and bind to the proton pump,
Okay.
shutting down acid production.
So it's like they have a built-in targeting system.
Exactly.
That's pretty cool.
It is.
But you mentioned earlier that PPIs can affect the absorption of other medications.
Right.
How does that work?
Well, it has to do with stomach acid playing a role in how certain medications are absorbed.
Okay.
When PPIs drastically reduce acid levels,
Yeah.
it can change the way those other drugs are broken down and absorbed by your body.
So it's like changing the environment in which those medications are supposed to work.
Exactly.
What are some examples of drugs that might be? Some medications that rely on stomach acid for proper absorption include ketoconazole, itraconazole digoxin, and certain antiretroviral drugs.
So it's really important to be aware of these potential interactions.
Yes.
And discuss them with your doctor.
Absolutely. It's all about individualized treatment.
Speaking of interactions, Dr. Hasan's lecture highlights a particularly important one between PPIs and clopidogrel.
Right.
Can you tell us more about that?
Sure. Clopidogrel is a blood thinner often prescribed to prevent heart attacks and strokes.
Okay.
It's also a prodrug like PPIs,
Got it.
so it needs to be activated by an enzyme in the liver.
Okay, so another medication that needs a little help to become active.
Yeah.
What does this have to do with PPIs?
Here's where it gets really interesting. Some PPIs, like omeprazole and esomeprazole, happen to inhibit that same enzyme needed to activate clopidogrel.
So if you're taking both medications, the PPI could prevent the clopidogrel from working properly.
Exactly. And that means the clopidogrel might not be as effective in preventing blood clots.
That's a serious concern.
It is.
What can be done to avoid this interaction?
Well, the good news is that not all PPIs have this effect.
Okay.
Pantoprazole and rabeprazole, for example,
Yeah.
have much less of an impact on that enzyme.
So if someone needs both a PPI and clopidogrel, those would be safer options.
Yes. They're generally considered the preferred choices in this situation.
Right.
It's all about understanding these nuances and tailoring treatment to each individual's needs and medication profile.
That's a perfect example of why it's so important to have open communication with your doctor and pharmacist.
Absolutely.
Now let's circle back to antacids for a moment.
Okay.
They seem like a straightforward way to neutralize acid.
Yes.
What are the different types of antacids available?
There are a few commonly used ones,
Yeah.
each with its own quirks and potential side effects.
Okay.
Aluminum hydroxide and magnesium hydroxide are two of the most common.
Right.
You'll often see them combined in over-the-counter antacids.
Is there a reason for that?
It's actually quite clever.
Yeah.
Magnesium hydroxide tends to cause diarrhea, while aluminum hydroxide can lead to constipation.
Okay.
By combining them, you get a more balanced effect on your bowel movements.
So it's like a yin and yang of antacids,
Exactly.
counterbalancing each other's side effects.
Yeah.
What about calcium carbonate like Tums?
Calcium carbonate is another good one,
Okay.
but it's important to be mindful of potential side effects, especially with long-term use.
What kind of side effects?
Taking too much calcium can lead to hypercalcemia,
Okay.
which can cause a variety of symptoms and complications. It's also worth noting that calcium carbonate can interact with certain medications.
So even with over-the-counter medications, you have to be careful.
You do.
What about sodium bicarbonate like Alka-Seltzer?
Sodium bicarbonate works quickly, but it's absorbable,
Right.
meaning it can enter the bloodstream.
Uh-huh.
This can be an issue for people with certain health conditions like high blood pressure or heart failure,
Right.
because the sodium content can worsen fluid retention. And if you use too much sodium bicarbonate,
Yeah.
it can even cause something called metabolic alkalosis.
Metabolic alkalosis. That sounds a bit scary. What is that exactly?
It's a condition where your body's pH balance gets thrown off, becoming too alkaline.
So it's like the opposite of being too acidic.
Exactly. Your body needs a delicate balance, and messing with that can cause problems.
So even though antacids seem simple, there are nuances to consider,
Yes.
just like with any medication.
Right.
Now, Dr. Hasan's lecture also mentions mucosal protective agents,
Yeah.
which we touched on briefly earlier.
Good.
Can you tell us a little more about those?
These agents work by giving your stomach lining a boost,
Okay.
either by protecting it from injury, reducing inflammation, or helping it heal.
So it's like bolstering your stomach's own defenses rather than just neutralizing the acid.
Exactly.
What are some examples of mucosal protectors?
We've already talked about sucralfate, which creates a physical barrier over the ulcer.
Right.
Another example is misoprostol, which replaces those protective prostaglandins that get depleted by NSAID use. And then there's bismuth subsalicylate.
Yeah.
Remember our friend Pepto-Bismol? It not only neutralizes acid,
Yeah.
but also coats and protects the stomach lining. AND has antibacterial properties against H. pylori.
Wow. It's like a triple threat against ulcers.
It is.
Are there any downsides to using these mucosal protective agents?
Misoprostol, for example, can cause diarrhea and abdominal cramps. It's also important to note that it's not safe to use during pregnancy.
Another example of why it's so important to talk to your doctor about all medications, especially if you're pregnant or planning to become pregnant.
Yes.
What about sucralfate? Any downsides to that one?
The main side effect of sucralfate is constipation, and it can also interfere with phosphate absorption,
Okay.
potentially leading to low phosphate levels in the blood.
So there's always a balance to consider, right?
There is.
The benefits versus the potential risks.
Right.
Now let's dive back into the world of H. pylori and those eradication strategies.
Okay.
You mentioned triple therapy earlier.
Yeah.
Can you remind us what that involves?
Triple therapy typically consists of a PPI clarithromycin and either amoxicillin or metronidazole.
So it's a two-pronged attack targeting both the acid production and the bacteria itself.
Exactly.
Why is it so important to completely get rid of H. pylori?
Because if you don't fully eliminate the bacteria, there's a good chance the ulcer will come back.
So it's not enough to just treat the symptoms, you need to address the root cause.
Right.
You also mentioned that sometimes quadruple therapy is needed.
Yes.
When would that be the case?
Quadruple therapy is often recommended when there's a concern about clarithromycin resistance,
Okay.
meaning the bacteria have become resistant to that particular antibiotic.
That's a little worrying.
It is.
So it's like the bacteria are evolving and becoming harder to kill.
Right.
What does quadruple therapy involve?
There are two main types of quadruple therapy.
Okay.
One involves adding bismuth subsalicylate to the standard triple therapy regimen.
So that's 4 medications in total. What's the other type of quadruple therapy?
It's a non-bismuth quadruple therapy that involves a combination of amoxicillin, metronidazole, clarithromycin, and a PPI.
Okay.
So it replaces the bismuth subsalicylated with another antibiotic.
So it's like hitting the bacteria from multiple angles to increase the chances of eradication.
Exactly.
Now, shifting gears to GER.
Okay.
We've already talked about lifestyle modifications and those acid-reducing medications.
Yeah.
What about those pro-motility agents you mentioned?
Right.
Those sound interesting.
They are.
Can you tell us more about how they work?
Promotility agents help to move food through your digestive tract more efficiently,
Okay.
which can prevent acid reflux.
Got it.
One example is metoclopramide.
I've heard of metoclopramide being used for nausea and vomiting, too.
Yeah.
How does it work for GERD?
Metoclopramide blocks dopamine receptors in the gut,
Okay.
which actually enhances the effects of acetylcholine, a neurotransmitter that stimulates muscle contraction.
So it's like boosting the signals that tell your digestive muscles to work harder.
Exactly. This helps to strengthen the lower esophageal sphincter, LES, making it less likely for acid to reflux back up into the esophagus. It also speeds up gastric emptying,
Okay.
so there's less acid hanging around in the stomach to cause trouble.
That's fascinating.
Hmm.
Are there any other promotility agents commonly used for GER?
Domperidone is another option.
Okay.
It works similarly to metoclopramide, but has a lower risk of certain side effects.
Oh, what kind of side effects are we talking about?
Metoclopramide, because it can cross the blood-brain barrier, can sometimes cause movement disorders.
Movement disorders. Those sound serious. What do they involve?
Things like tremors, muscle stiffness, and restlessness.
So it's essentially interfering with the brain's control of movement.
That's right. These side effects are more common with higher doses and long-term use.
So it's a medication that needs to be used cautiously and under careful medical supervision.
Yeah.
What about domperidone? Does it have similar side effects?
Domperidone has a much lower risk of those movement-related side effects because it doesn't cross the blood-brain barrier as easily. However, both metoclopramide and domperidone can increase prolactin levels.
Prolactin? Isn't that the hormone involved in milk production?
Yes, that's right. Elevated prolactin levels can cause side effects like galactorrhea,
Okay.
which is the production of breast milk in men or women who are not breastfeeding.
Wow, that's definitely not something you'd want to experience.
No.
So these promotility agents have their benefits, but also potential risks. It's a reminder that all medications,
Yes.
even those used for seemingly straightforward conditions like GERD, can have complex effects on the body.
It really highlights the importance of individualized treatment and weighing the potential benefits and risks of each medication.
Absolutely. Now, I'm curious, Dr. Hasan's lecture focuses on the medications and lifestyle changes for treating peptic ulcers in GERD.
Oh, wait.
Are there any surgical options available for these conditions?
Surgery is typically reserved for cases where medications haven't been successful or when there are complications such as bleeding, perforation, or obstruction.
So it's not the first line of treatment,
Yeah.
but it's an option for those who need it.
Yeah.
What types of surgical procedures are available?
For peptic ulcers, surgery might involve removing part of the stomach
Wow.
or repairing a perforation.
Okay.
For GRE, a common surgical procedure is called fundoplication.
Fundoplication.
Yeah.
That sounds pretty intense. What does it involve?
Fundoplication involves wrapping the upper part of the stomach around the lower esophageal sphincter
Okay.
to strengthen it and prevent acid reflux.
So it's like reinforcing the door between the stomach and esophagus to keep the acid from splashing back up.
Exactly.
That makes sense.
Uh,
Are there any other surgical options for GRD?
yes, there are newer, minimally invasive procedures available, such as LINX surgery.
LINX surgery.
What's that? It involves implanting a magnetic ring around the lower esophageal sphincter.
A magnetic ring. How does that help?
The magnetic ring helps to keep the sphincter closed, preventing acid reflux.
Okay.
But it's flexible enough to allow food and liquid to pass through normally.
That's amazing. It sounds like a much less invasive approach than traditional surgery. Are there any risks or complications associated with these surgical procedures?
As with any surgery, there are potential risks such as infection, bleeding, and complications from anesthesia.
Right.
It's essential to discuss the risks and benefits thoroughly with your doctor.
So, surgery can be a valuable tool in managing peptic ulcers and GERD, but it's important to weigh the potential benefits and risks carefully.
Absolutely.
This has been an incredibly comprehensive deep dive into the world of stomach troubles.
It has.
We've covered so much ground, from the underlying causes and symptoms
Right.
to the various treatment options available, both pharmacological and surgical.
It's a testament to the complexity of the human body and the constant advancements in medical science.
Now, before we wrap up this fascinating deep dive,
Yeah.
I'd like to turn our attention to something Dr. Hasan mentioned in his lecture
Okay.
that I found particularly intriguing.
Oh, what's that?
He talked about those different pathways involved in acid production.
Yes.
Acetylcholine gastrohistamine.
Yes, those are the three main signaling pathways that tell those choroidal cells to start pumping out acid.
Exactly. And it made me wonder, are there any other pathways, perhaps ones we haven't even discovered yet,
Right.
that could also be playing a role in acid production?
That's a great question. It's definitely possible that there are other mechanisms involved in regulating acid secretion that we haven't uncovered yet.
And if we could identify those pathways, it could open up a whole new avenue for developing even more targeted and effective treatments, right?
Absolutely. That's what makes this field so exciting.
Yeah.
The constant quest for knowledge and understanding drives scientific progress.
It's a reminder that there's always more to learn,
Yes.
even about things we think we already understand.
There really is. It's pretty amazing.
Yeah, well said.
Yeah.
So we've talked a lot about peptic ulcers and GERD,
Yeah.
but I'm curious, are there other conditions that involve like similar mechanisms or treatments? You know, maybe they aren't ulcers, but they involve the same players.
Yeah.
Like stomach acid or H. pylori.
That's a great question. There are actually several other gastrointestinal conditions that share some similarities with ulcers and GERD.
Okay.
One that comes to mind is gastritis.
Okay.
It's essentially inflammation of the stomach lining
Uh-huh.
and can also be caused by those familiar culprits,
Right.
H. pylori NSAIDs, and even excessive alcohol consumption.
So similar triggers,
Yeah.
but affecting a different part of the stomach.
Right.
What about the treatments for gastritis? Are they similar to what we've been talking about for ulcers and GERD?
It really depends on what's causing the gastritis.
Okay.
If it's H. pylori,
Right.
then antibiotics are necessary to knock out the bacteria.
Okay.
If NSAIDs are the culprit,
Yeah.
then stopping or reducing their use is key.
Got it.
And of course, those lifestyle modifications we talked about,
Okay.
like avoiding trigger foods, managing stress, and limiting alcohol, can all help to soothe the inflammation and promote healing.
So it sounds like a holistic approach is important regardless of the specific condition.
It is.
Are there any other conditions worth mentioning that have these overlapping features with ulcers and GERD?
Another one that comes to mind, although it's much rarer, is Zollinger-Ellison syndrome.
Okay.
It's characterized by tumors that secrete a hormone called gastrin.
Gastrin. That rings a bell. Isn't that the hormone that tells your stomach to produce acid?
You got it. So in Zollinger-Ellison syndrome, you have way too much gastrin being produced,
Wow.
which leads to a massive overproduction of stomach acid.
Wow, that sounds intense.
Yeah.
How is that condition treated?
The main approach is to control that runaway acid production with high doses of PPIs.
Okay.
In some cases, surgery to remove the tumors might be necessary.
It seems like no matter what the condition, that balance between aggressive factors and the body's defenses is key to a healthy stomach.
Absolutely. And it's fascinating how even seemingly simple things like everyday stress or popping an over-the-counter painkiller can disrupt that delicate balance.
This has been an incredible deep dive into the world of stomach troubles.
It has.
We've learned so much about the causes, the symptoms, the treatments, and even the potential for future discoveries.
It's a reminder that we are always learning and that there's so much more to discover about the human body.
And it highlights how important it is to be proactive about our health.
Yeah,
Listen to our bodies and seek medical attention when we need it.
absolutely.
But beyond treatment, there's also the question of prevention.
That's an excellent point. What if we could go beyond treating these conditions and actually prevent them in the first place?
Exactly. What if we could identify people at high risk
Right.
and intervene early
Yeah.
to reduce their chances of developing these painful and potentially dangerous disorders?
Great thought.
That's something I'll be thinking about as I continue to explore this fascinating field.
It's definitely an area ripe for research.
Well, this has been an incredibly insightful deep dive, and I hope you, our listener, have enjoyed it as much as we have. We've covered a lot of ground, but we've only just scratched the surface. What stands out to you? What other questions do you have about ulcers, GERD, or any of the other conditions we've touched on today? Keep that curiosity alive, and remember, knowledge is the best medicine.
Until next time, keep exploring and stay curious.